Hello, thank you for joining us today for Prepare to Care, a caregiver resource guide presented by Gary Williams, Associate State Director for Community Outreach for AARP. Thank you, Mr. Williams, for joining us today.
Denise, it's a pleasure to be back with you again today. It's such a wonderful time yesterday, and I'm so appreciative of the opportunity given me to be a guest on this very important program today. So thank you very much.
All right, I will go ahead and start your presentation. Just give me 1 second here.
Absolutely.
All right, take it away, Mr. Williams.
Wonderful. Thank you again, Denise. Good morning, participants. Thank you for the opportunity to share information with you today as it relates to the very specific process of preparing for caring for loved ones. This is a process that we look at very seriously at AARP. Our state director, Joseph Sanchez, and the remainder of our staff are very dedicated to the provision of services that enable people to live higher quality of life than they would normally without such resources. So we're so glad to have the opportunity to present some information today that's designed to help individuals on their journey toward being qualified caregivers. So I'm going to walk through a set of slides here today that are again intended to share information. It may not be the most practical for everyone, but we're hopeful that you will be able to take away pieces of this presentation and apply it readily to your daily lives as caregivers. Your role is a very important one, and we feel at AARP that you need to have the resources and tools that enable you to be the best that you can in the provision of care and services. Next slide, please, Denise. I'd like to start off with this slide because I think to me it is indicative of the realities of our world today. The slide is words that were spoken by Rosalynn Carter, who was the former First Lady, the wife of Jimmy Carter, President. And she works now with the Caregivers Association. And her words are very profound in the sense that she says that there are 4 kinds of people in the world. First off, there are those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers to provide services to them. To me, this resonates because I fit in a couple of those categories in that my wife was principal caregiver for her mom as well as her grandfather who suffered from dementia. I have had individuals in my family, and as recent as yesterday, had one of my relatives, my aunt, pass from Alzheimer's disease. Her husband too is suffering from a diagnosis of dementia and related disorders. So this is a very important subject for me, and I feel honored that AARP has given me resources and allowed me opportunities to share those resources with those we come into contact with. So think about that as we transition through this presentation. Where do you sit within the scale of those 4 different areas? Have you been a caregiver? Are you currently a caregiver? Do you think that there'll be opportunities for you to be a caregiver in the future? And certainly there will come time, if we are allowed to stay on this earth long enough, we will probably need someone to provide care and services to us. Next slide, please. I want to start off by talking about the prevalence of Alzheimer's dementia-related disorders and the effect that it has on individuals. I'll go through several slides in the course of this presentation that are all designed to shed light. I'd like to reiterate that not everything will be applicable to the world that you live in, but hopefully this will provide information that will be helpful to some extent to you, or that you're able to share with other loved ones to help them in their journey. Caregiving is a journey. It's an ever-changing journey, and it involves a tremendous number of individuals. For instance, we currently have right at 40 million individuals in the United States that are caregivers. they're providing care and services to adults. That constitutes about 17% of our population who are currently caregivers on an annual basis. In New Mexico specifically, we have about 270,000 New Mexicans who are primary caregivers, typically serving in the role of family caregivers. That would be delineated from individuals who are working in terms of professional services. We're talking family caregivers, individuals who are taking on the roles of provision of care to loved ones, family members, and that's principally what we're talking about in terms of those numbers. When we look at those numbers, we also have to factor in what is the cost for delivery of those services, and is there reimbursement? In the professional arena, oftentimes individuals do the job of providing care because they're paid to do so. In the world of family caregiving, it's more likely that individuals are providing those services because of cultural norms. In that, I mean that it is historically been that individuals, you as a person progresses through the aging process, it's natural that family members step in when a need exists to provide care and help them transition through life stages. In New Mexico, we are very deeply entrenched in those cultural norms. And of those 270,000 New Mexicans, large extent, they're doing it because of love and passion for the individuals they're caring for. The cost for doing so is staggering. Estimated $43.5 million is what is provided in unpaid care and services over the course of 12 months. $43 million, that's a lot of money. And it's coming out of budgets that can, in a lot of cases, ill afford added expenses or unexpected expenses. So the impact is very deep and very strong and is continuing to grow as costs for provision of care and services seems to be escalating on a daily, hourly basis. The majority of our caregivers are females, and that doesn't, to me, come as a surprise because traditionally, historically, the women have been our backbone. I say that because I come from a very strong family of women who have been caregivers all their lives naturally. And I have to say, as a male, that the roles are changing, that men are taking on the role of caregivers more so than the norm has dictated previously. So about, again, 60% of our family caregivers are female. In terms of those numbers also, 8 in 10 of those caregivers are caring for one person. It may be a mother or father, it may be a grandparent, but there are also combinations of caregiving situations that we need to be mindful of. In our data research, we found that 1 in 10 care for a spouse. This has really created some hardships. It's created some learning opportunities as well. So we want to be mindful of those numbers as we move forward. Next slide, please, Denise. I'm going to talk a little bit now about realities of caregiving. There are certain aspects of caregiving that are unique, that are new to a lot of the caregivers who are taking on roles of being the principal caregiver for a loved one. Those roles include taking on the finances, being the attorney, being the individual who is point person on medical issues. I'll talk more about each and every one of those issues as we go along in this presentation. One thing that needs to be noted is that from a historical and a societal standpoint, there is a deep avoidance to talking about caregiving. Until very recently, we had not seen that insurance companies were concerned to the point where they were offering policies for individuals for long-term care and services. That's changing in terms of the face of caregiving today. But we've also seen that individuals, because of societal norms, we as the United States are a very youth-oriented society, meaning simply that it is believed that you must be young and healthy and vital, and those individuals are the ones who get a lot of the attention in terms of delivery of services. So we are typically in a situation where if you're advancing in the aging process, sometimes the realities are that you're relegated to a lesser role. We want to change that. We want to make sure that there's quality throughout the life cycle. So again, this presentation hopefully will provide insight allowing for that to occur. We're finding simply that most caregivers who are in the role of caregivers, either by choice or design, are unprepared to undertake the responsibilities of being a caregiver. They may not have the training necessary to complete difficult tasks, and that too will be discussed further in my presentation today. But emotionally, those issues are very profound as well as it relates to delivery of care and services. We find that there is a sense of lack of awareness of resources, and that is true to a large extent. However, I think that coupled with that, not having resources available is the fact that oftentimes there are resources that are available that people aren't knowledgeable of. So I think that's of equal importance as to not having resources. When you have a situation where resources do exist, but individuals don't have means or don't have avenues by which to pursue search for those resources. So we'll talk a little bit more about that also. Next slide, please, Denise. Caregivers certainly are faced with many difficulties as they deliver care and services to loved ones. Some most important that are notable that comes up continually in our conversations or the fact that the task of being a caregiver becomes more complicated and more complex as the tasks that individuals are asked to undertake become more complex and difficult in nature. We're seeing also that there is a severe lack of training as well as support for caregivers in the everyday working environment. We want to try to amplify the availability of resources. We want to simplify and provide resources along the lines of one, legislation, and I'll talk about that again as we advance through this presentation. We're talking about also changing family obligations. We have situations now where individuals are required to undertake a variety of different tasks as the primary caregiver for a loved one. We're trying to make sure that these resources are manageable and that individuals are able to juggle those responsibilities and those obligations. We're finding that the role of a caregiver is affecting our economy. We're seeing shifts in employment practices and conditions in the workplace that has fostered an environment where there is a flight, meaning individuals are leaving the workforce at phenomenal levels to take on the role with confidence of caring for loved ones. So we want to talk a little bit about that today and see if we can identify some resources that will allow for individuals to stay in the workforce, continue to be productive, add to their retirement benefits, because the reality is when they do leave the workforce early, it decreases the fact that they will have a healthy retirement once they do identify that they want to leave the workforce. We're going to talk a little bit about emotional demands on a caregiver. Tasks, responsibilities that are undertaken by caregiving puts tremendous strain on individuals. And we find that there is a need for emotional support for individuals who are in the process of providing care for extended periods of time. We want to look at also what housing opportunities are there that individuals may not be aware of. What are some of the barriers that have been created as a result of our laws that are currently in place, covenants and restrictions upon co-occupation of housing structures, things such as individuals who may be on governmental programs where they have housing assistance, but because of our societal norms, those new norms where grandparents are taking care of the grandkids, when those responsibilities come to play, housing is very important, because if you violate some of the tenets of your housing agreements, it could cause eviction. So there are a myriad of different things that caregivers are faced with when they're bringing individuals into the household, or when individuals who are required to stay in their own dwellings and there are substandard situations. So we'll look at that as being a very important issue to be addressed by caregivers. Next slide, please. Some of the key factors that caregivers are faced with, or how do you conduct needs assessments that really identify for you what really is transpiring with the individual who is the care recipient, and how can you interface with that individual on a level that increases the quality of life. So what are some of the tools that are available that individuals can tap into is a point of this discussion today, and we'll try to identify some of those to you. Development of a team is going to be very important. We'll be talking very specifically as this conversation evolves today about the development of the team. I'll give you specific guides and let you discern what might be helpful to you. It is our hopes as well, through the provision of this information, that if it's not applicable to you personally, that you may be able to take this information and share it with someone who will find value in it. We'll talk a little bit about training needs for individuals who are in the role as a caregiver. How can we support those individuals? How can we prevent opportunities for them to burn out in the role as a caregiver? We want to talk about the prevention of social isolation, which is a major consideration. AARP has focused a lot of our resources on what do we do to provide resources that will allow individuals to continue to engage in a meaningful activity plan that may be social in nature. It may be educational, such as lifelong learning. But if we don't have those in place, we'll find that individuals will, they will sink within themselves and they will isolate themselves from general population. And it's been proven medically and scientifically that a big part of the will to live is how are they incorporated into the mainstream of society. And when social isolation is a component, that their opportunities to flourish in our society is diminished. So let's talk a little bit about that social isolation as we proceed. Identification of resources. Caregivers, as I said earlier, are taking on a myriad of different roles. One such role is to make sure that there's monitoring of the events and activities that individuals that we're caring for are engaged in. When you find that an individual, talking about that last point, is socially isolated, when individuals, we work at AARP on provision of information around fraud, scams, and identity theft. When a person is socially isolated, they are more apt to answer a phone call where someone on the other end may be trying to separate them from their resources, those financial resources. They are looking to scam them, to steal their identity and set up new accounts and to really bankroll these individuals. So as a caregiver, a part of your duties and responsibility is to make sure that the individual who's a recipient of care is safeguarded from those types of situations. Caring for special needs population. We're talking today at this Alzheimer's conference because that's a very important aspect of our society today. Larger and larger numbers every day are being diagnosed, or there's processes where we see dementia and related disorders are really coming to the forefront. That is true with Parkinson's as well as some other debilitating conditions and disease processes. So how do we prepare individuals to be mindful, to be educated, to be effective in the delivery of services? So hopefully that planning process that we'll go through will be helpful in answering some of those questions. Next slide, please. Today, we'll be talking a little bit about how does today's caregiver differ from caregivers of, as it used to be said, and I had this in my slide, but caregivers of yesteryear. In that yesteryear format, we found that, again, with women being the largest proponent of caregivers, that when someone within the family became debilitated or because of illness or a medical condition that limited their capacity to engage, mostly women were the ones who were at home, who took care of the responsibility of providing that care and services. Today, we'll talk about what today's caregiver has to do to juggle jobs and caregiving tasks. We'll talk about the average age of the caregiving process. It's typically about 1 to 4 years. We'll talk about what are the dynamics as it relates to children living in the home of a caregiver, a primary caregiver, and the impact that that has on everyday life. We'll talk about undertaking complicated medical tasks. So each one of those components we'll be now talking about. Denise, if you'll advance the slide, I'll talk about the juggling. I broached the issue of employment earlier and the reduction of income that's associated with the employment plight and flight of individuals from the workplace. We talk about that on just about every time we get together as staff. We talk about what can we do to ensure integrity of our workforce, and how can we provide opportunities for individuals to be knowledgeable and to avail themselves to benefits in the workplace that will alleviate some of the stress of an individual exiting the workforce. How can we work on legislation that will allow for family leave time in organizations that don't currently offer that? What are we doing toward the provision of FMLA benefits that allows for individuals to step away from the workforce without penalty? Those FMLA benefits, unfortunately, don't provide payment, but we're working diligently on behalf of caregivers and everybody else in our society to try to structure our laws that will be protective of individuals who are serving as caregivers. We talk about technology and care. We're finding that as society advances, new technology is introduced on an ongoing basis. And oftentimes that technology is provided with little training as how to utilize it, how to best capitalize upon the availability of it. So how do we work in concert with those providing those new technological advancements to make sure there are opportunities to educate? Oftentimes that can be seen in TEK, technology, education, and knowledge type programs, where simply put, caregivers can be instrumental in helping individuals use smartphones to have conversations, again, to avoid that social isolation. So how do we incorporate programming that takes advantage of this newfound technology? We're looking also at different variety of care options that are coming on to the surface. So how do we take advantage of respite type programs? So if a caregiver is providing care in addition to working, again, it's almost guaranteed that there will be a degree of burnout. So how do we provide options such as respite type programs that give a break to our caregivers to let them recoup, to let them maintain their health status themselves? As it relates to individuals with Alzheimer's, dementia-related disorders, oftentimes the recipient of care is in a lot better condition than the caregiver themselves, because that caregiver is so burnt out on trying to juggle all the tasks that they're asked to do. So how do we utilize technology and care options to improve the delivery of care and services? I broached the subject of children at home, and I talked a little bit about the sandwich generation, whereas in reality, it is a club sandwich. New Mexico, you may not know this, but New Mexico leads the country in numbers of grandparents raising grandchildren. So what we're seeing is very blended households where individuals, in a number of cases, you may see the primary caregiver taking care of their parent, and also in cases, their grandparents, and their children, or vice versa. It's taking care of a parent, their children, and their children's children because of economic status and changes that have occurred, such as military service, where an individual may be deployed in our military, and the children are left to the grandparents to provide care. So that creates what we call a club sandwich. So it's far more complicated than the traditional sandwich generation. It is a club sandwich. And we need to make sure that we're providing resources to empower individuals to tap into that and to live the best quality life that they can. With the pandemic, the coronavirus, we're seeing a change in how our education systems operate. There are newfound requirements for individuals to learn from the home environment, as opposed to going off to school. Those situations I think we had a tendency to take for granted. When a child got up in the morning, we helped them to get dressed, we fed them, and we send them off to school. Well, now we're getting them fed, we're getting them dressed, and they're sitting down at a table, such as my grandchildren are now, right next to their mom who is working at home, or their dad who is working at home. So the opportunity for individuals to go to their workplaces and to work in a normal work environment, free of some of those stressors that are now being found in being the teacher at home. Those weren't existing. And now we're seeing that this compounds the rights and responsibilities of the caregiver to have some peace and quiet. So we need to look at that very seriously and say, how are we managing those newfound responsibilities of being a caregiver, a mom, a dad, and a teacher in the same voice and with the same resources? So that's something that's very difficult and we need to be mindful of. We're finding that let me qualify this next statement by saying I've spent the vast majority of my professional career in the healthcare field. I spent 26 years regulating healthcare for federal state governments. I was a health facility surveyor for HCFA, Healthcare Finance and Administration, through the state of New Mexico. I worked in quality assurance, utilization review, and acute care environments. And my background's quality assurance, utilization review. When I was performing work in the healthcare field, there were very specific lines drawn as to what could and could not be done by non-licensed professionals. As I look at today's world, I'm seeing that that has changed vastly, in that individuals who are operating as family caregivers are now being required to manage medications. They're responsible for operation, cleaning, maintenance of infusion therapy equipment. They're being required to take on the role as individuals who are providing wound care. And oftentimes the reality of that situation is that they are ill prepared to do so. They've not had the training, and the risk management aspect of it is not considered in the delivery of those services. So what are we going to be doing to be mindful about these situations and to look to opportunities to provide more training, more resources, more connectivity to support groups that will help individuals to undertake these tasks? Next slide, please. Some of the major caregiving tasks that are being asked of our caregivers today are the normal activities of daily living, as well as instrumental ADLs, activities of daily living, eating, sleeping, walking, or ambulation. And then the instrumental would be things such as shopping, doing chores, setting up appointments. So those are roles that are now being taken on by family caregivers. There's also the need for specialized care and procedures. I broached that subject a little while ago, but we want to make sure that we're understanding that these are elevated in terms of importance as the caregiver does their work. So how are they prepared to take on those roles of provision of care to specialized populations? In our medication management, individuals are given medications without understanding contraindications, meaning simply how does one medication interact or help or diminish the capacity for one given medicine. We need to make sure that we're giving training, that individuals are receiving the necessary skills for management of medications, that they're doing so in an environment that is protective of the individual who's receiving the medication, as well as the risks and liabilities associated with provision of that medication. We're asked to be legal representatives. As you know, we're becoming more litigious as a society, and everything is challenged. Individuals are very reticent about providing information. We have invoked the HIPAA laws that makes it somewhat difficult for caregivers to deliver their care and services and be proficient in that delivery because they are excluded from conversations with healthcare professionals. At the very end of our conversation today, I'll talk about some legislation that makes that process a little bit easier, particularly in the acute care environment. Financial management, that's a double-edged sword there. We're asked to step in a lot of cases to manage the finances of our loved ones. And oftentimes that is a very difficult task in that individuals are reluctant to turn over, to even talk about their finances, more or less turn them over to family caregivers. But we need to make sure that we're employing strategies that allow for full disclosure, for concrete evidence as to the best interest being observed by caregivers when they are asked to manage finances for a loved one. Next slide, please, Denise. We also are, as caregivers, charged with being mindful of special populations who are receiving care and services. I spoke earlier about my role as a veteran and the interest that I have. As a matter of fact, we have a veterans town hall coming up on Tuesday of next week in honor of November being Veterans Observance Month and appreciation. But veterans are a very special population, and we want to make sure that our caregivers are skilled to understand the dynamics of military service. There are a lot of difficulties faced by our returning service members, those who have been on the direct line of conflict, and those who maybe have been traumatized by other events as being associated with military service. So AARP has mounted a program where we have a plethora of resources available for veterans, military, and their family members. So I strongly encourage you to go to our website, aarp.org/New Mexico, or you can look at aarp.org/veterans, and you can find a myriad of different resources that are available to assist you. There are toolkits, there are work processes that are delineated for those providing care and services to our veteran population. I talked earlier about fraud and scam. We have a lot of information, booklets on how to prevent, how to recognize, how to intervene, how to recoup resources. And that's a very elongated process, but AARP is here for you, providing those resources that enlighten you to what you can do should an individual be subject to scam, fraud, or identity theft. AARP is working very diligently also on making available resources around what constitutes livability in communities. Our evidence shows that individuals are desirous of staying in their homes, staying in their communities. And to that end, AARP has put forward resources and partnered with the World Health Organization to create 8 domains of livability. So information about livability in your community, how you can engage, and under the 8 domains, you see things such as medication, how to deal with access to medical care and services, housing, education, civic engagement. So a variety of different things are addressed under the headings of livable and age-friendly communities addressed by AARP. Dealing with the pandemic has been very difficult for individuals because we're finding that in addition to trying to protect individuals through the provision of PPE or personal protective equipment, there comes a lot of issues as to mobility or access to community-based resources when we're all staying at home and we're not getting out and utilizing those existing resources in a community. We find that the quality of life will diminish. We find that also in certain communities where caregivers are charged with the nutritional health or again, the medications, that we have such things as food deserts where individuals aren't provided access to quality foods that are healthy, that are conducive to dietary compliance. So it makes it very difficult for an individual to maintain their medical and health status. I've already talked about social isolation, so I won't belabor that, but it is a very important part to recognize. Next slide, please. So my question to you today is, are you prepared to provide care? Are you prepared to be the best you can at the delivery of those very needed services? If you are, I congratulate you. If you're not, hopefully what the next stage of this presentation will do is to open your eyes to some resources that will allow for you to be more proactive about planning for and engaged in the delivery of caregiving services. Next slide, please. I'm going to start off by talking a little bit about some tips that you should be mindful of as you proceed on your journey to being a qualified caregiver. Um, because of societal norms, again, because of pride and dignity, oftentimes we do not ask when help is needed. So I am strongly, strongly, strongly encouraging you to assess where you are in the caregiving process. And should you discern from that assessment that you need help, don't be afraid to ask for it. Don't be too proud to ask for it, because you'll find that it will benefit you as well as those that you're charged with caring for. Join a support group. There are a myriad of different support organizations and support groups are readily available that you can tap into to learn about what have been experiences that have been encountered by individuals who may have served in the same role that you're occupying now. What are the resources? What are the learning opportunities that you can avail yourself to? So look for those support groups and join them. Do so electronically, by internet, do that by going to where opportunities exist and safety measures are considered. Do that by participating virtually in conferences and workshops such as you're doing today. That information is very important and will be very helpful to you down the road. If possible, as I said, use the internet. And I say if possible because the reality is that we are in a sparsely populated state that's geographically very expansive, and not a lot of areas of our state allow for broadband services. So we have to go old school in a lot of cases, but if you have internet services, tap into that. If not, look into organizations like the Alzheimer's Association. I myself participated in the Savvy Caregiver program. And it is a wonderful, wonderful program that enlightened me in a lot of ways that I was not aware that I was lacking information in. So look for opportunities through the internet to understand how you can access those resources. I think about when I have had to go to my doctor, and as a former healthcare professional myself, I sit down and I contemplate what that conversation will look like with my healthcare provider. And if I didn't write it down, it is likely that when I get face to face with that caregiver, I am more focused on the information he or she is providing me. And by the time that opportunity to ask questions, it slips my mind, or I leave the office or the environment and I say, oh, I meant to talk to the doctor or the specialist about this or that. Write down your questions in advance so that when you present to these healthcare professionals or the support groups, that you know what you want to ask. That's going to help you to the largest extent. So write it down, take it with you, be mindful of what is really important to you and get those questions answered as best as possible. I already talked a little bit about attending conferences in this virtual environment. AARP, I know that every day we are exploring different platforms by which to provide services in a remote and a virtual environment. Evidence of that is this conference today. We would be terribly remiss if we didn't live up to our responsibility to identify ways to continue to provide information that is helpful to caregivers. So look for opportunities such as you're employing today to learn remote and through virtual means. Subscribe to publications. There are tremendous resources out there. It provides lists of caregiving resources, new strategies, talks about legislation that's being proposed or acted upon. A lot of those publications can be a great source of continuing education for caregivers. Next slide, please, Denise. Now we're going to get into the meat of the presentation. This portion of the presentation will talk about effectively setting up strategies to plan for the delivery of care and delivery of services. We're going to talk a little bit about the 5 steps of caregiving planning. That starts with a conversation. Forming a team is this next step. Making a plan, finding support, and caring for oneself. All aspects of this conversation. You'll see pictured there to prepare, I'm sorry, got a little tongue-tied. Prepare to Care booklet. That is our guide that we are making available. And it is available in the resources as part of this conference. So if you're interested, tap into that. You'll find that included in that guide are a lot of tools that you can instantly use to assess needs, determine medications, identify what's important for an individual that you're providing care to. So again, it's a wonderful tool, and I encourage you strongly to take advantage of the availability of that document. Finally, we'll talk about finding support and caring for yourself. So I'm going to go into each one of those 5 categories now, and hopefully you'll find this helpful to you. Before I start though, I want to read this to you. Every time I try to bring up the future, my dad just shuts down. He tells me the important papers are in the cabinet, but the conversation never seems to go beyond that. How many times have you as a caregiver experienced that type of environment where individuals just don't want to talk about it? They're guarded, they are pride filled. And so we need to move beyond this. We need to identify strategies, and planning will allow you to open up some of those doors to be more effective as a caregiver. Next slide, please, Denise. The first step in the process of this care planning is starting the conversation. We need to be mindful of opportunities to start the dialogue. Because of our generational issues, we find that having this conversation is oftentimes very difficult. As I said, it's avoided with all measures that can be applied. And individuals need to make sure that you're not trying to introduce conversation about caregiving or planning for the future when an individual may be tired or suffering in pain or whatever. There has to be an optimal opportunity for introducing this conversation. You can also understand that if you start the conversation and the individual becomes irritated or indicates signs of distress about doing so, stop it at that point and revisit at a later time when it's more conducive to the delivery and absorption of the information. You need also to be mindful who is the best person to start the conversation. If there had been antagonism between the care recipient and the primary caregiver, that person may not be the best one to talk to that person about how you plan to intervene and provide care and services. There may be innate issues that a person has dealt with all their life, and the caregiver may be, again, a little tense. That's not an ideal environment to start these conversations. So make sure you're mindful of who the person is and the timing that's associated with the introduction of the conversation. One needs to understand also where there's discomfort or a person is uncomfortable with the subject matter. Make sure the person who is delivering that messaging is equipped and comfortable in doing so. If they're not, seek out individuals who are more at ease at taking on that role of communicating what's going to be a part of the plan. It needs to be conducive in all ways possible with the delivery and absorption of that information. You need to identify what are the biggest concerns, both of the individual who is a care recipient and those who are delivering the care and services. What are their concerns and what are their priorities? If you fail to do so, you may be in good faith trying to do something that's not in the best interest or not of the importance that should be for the care recipient. So make sure you're on the same page with that person who is receiving the care, and that this is in fact a priority for them. Next slide, please. Tips for beginning the conversation. Most important is making sure that you include the care recipient. There have been a number of cases that I've been involved with where there has been failure to include an individual who will be receiving the care. And when you try to do so, you meet with tremendous amount of resistance. The individual is not in tune with what you're trying to do for them or is opposed to what you're trying to do for them. So talk with that person, understand what they want. What constitutes quality of life for one individual may be vastly different from another individual. Keep in mind that the most important thing is doing for that individual that you're caring for what is most meaningful to them and is most effective. Respect the wishes of individuals that are involved in your caregiving process. If an individual says, I don't want this to be delivered to me by means of a care process, be respectful of that. Certainly, there are times when that individual may not be thinking clearly or with the amount of information that they need to make an informed decision about what is being proposed, but be mindful and respectful of the wishes to the best extent possible. It may also mean that you need to respect an individual that is a part of your team's wishes not to engage in a caregiving process. A lot of people are not comfortable in delivering of care, whereas others may be right at home at the delivery of care. When we talk about the personal care that's being delivered to an individual, not everyone is comfortable in that process. So make sure that you're mindful and that you're clear of the issues that you're charged with facilitating. So that's the next step, clarifying what are the care issues. When you engage in your needs assessment, that should be abundantly clear to you as to what are the care issues, what do we need to focus on, what is not important at this stage in the caregiving process. During all the caregiving process, be sure to express your concern for the individual. Let that person know who is receiving the care that what you're doing is intended to make sure that their life is improved. So make sure you're expressing all the time your concern for the well-being of that individual. And also, lastly, as it relates to this slide, recognize your limitations. We may have good intentions of doing all we can for a loved one, but if we're ill-equipped or if we are physically or psychologically not prepared to do so, we need to recognize that and call professionals in to provide that needed services at that level. Next slide, please. I talked a little bit about resistance in terms of individuals that we encounter, that difficult family member. We need to recognize where resistance is being offered by the care recipient, issues of individuals who are on your team not wanting to hold up their end of any agreement that you may negotiate. So we need to make sure that when resistance is offered, we understand what point that resistance is coming from, and we identify the best we can how to go around those difficult situations. We need to push issues where necessary. If an individual who is a care recipient doesn't feel a certain service needs to be rendered, talk with them and identify the importance and how this fits into their overall quality of life. In certain cases, we can be very passive in terms of purveyance of that information. In other cases, we must be more direct, particularly as it relates to the safety of that individual. Where we find we're meeting with resistance, oftentimes we find that it is helpful to involve other individuals who may occupy a different space in the life of that recipient of care. From a generational standpoint, great trust and responsibilities are given to our healthcare professionals, our doctors particularly, with their elderly. They maintain a certain high station in those individuals' lives. So if you're having difficulty in terms of an individual being medically compliant with orders or taking medications or whatever, maybe you can call the doctor in and have a conversation with that care recipient so that the information is coming from a recognized and respected individual in the mind of that care recipient. And if that's not working, you may find that the services provided within the faith-based community can assist in getting that message conveyed to the recipient of care. Friends, trusted friends who may have experienced caregiving themselves, who may have insight into resources, those are important in terms of resistance. Oftentimes, a trusted friend or person who has firsthand experience is more likely to be able to convey the importance of medical compliance or compliance with plans that are identified than you as the primary caregiver. So recognize that and use all available resources. Next slide, please. In terms of our next step, we want to make sure that you're forming your team. When you're doing so, list everyone who possibly can help in the delivery of care and services. They may not occupy a high role in terms of delivery of services, but there may be a time that you need to call upon them. And by listing them, you can readily identify and reach out to those individuals. I've already talked about the difficulty in some family members. Oftentimes we find that there are rifts within family members. How do you effectively deal with that? Whereby you keep in mind what the overall objective is, and that's to provide quality care and services. It is important that you designate a family team member because as you look at development of your list, you'll find that there are so many different areas that you need to focus on. If someone isn't leading and orchestrating that care delivery system, you'll find that there will be a lot of opportunities for things to fall through the cracks. That team leader can keep you on track, making sure that individuals who have been given responsible areas are adhering to that responsibility, and that team leader can be charged with making sure that team stays on track with what you're outlined to do. Next slide, please. Family conflicts. Understand and recognize where those dominant tensions exist between family members. Recognize that stressors is an important part of resolving conflict. What's causing these problems? How do you avoid it? How can you relieve some of the stressors from an individual so they don't burn out or so they don't suffer medical fatigue themselves? Recognize that relationships in certain cases are going to be long-term. Some, as I said, cases are for 1 year, some are 4 years or longer. Recognize that and deal accordingly. Also be able to recognize emotions that are associated with mental, physical declines or diagnoses that may not be favorable for the individual that you're caring for. Next slide, please. Our third step deals with making the plan, and this is just a visual. I'm going to ask Denise to advance to the next slide, please. When you're making your plans, make sure that, if at all possible, that your first meeting among your team members is a face-to-face meeting. That way you can gauge reactions, you can intervene, you can be more specific in clarifying what the asks are of those individuals as team members. If you can't do it face-to-face, technology, fortunately, allows for us to video conference. We can do Zoom calls. We can utilize or mirror the different resources available to us. But that first meeting, that kickoff meeting should be face-to-face or via a conference or Zoom platform or other available platforms. Follow-ups and subsequent meetings can be by email as long as you establish and you participate in a continual process provision of information. Keep that conversation going. Again, I'll reiterate, involve the person receiving the care. Take notes so that you can reflect back on who was given this assignment. What did you say you will do? Did someone say that they were going to bring forward a resource and it doesn't materialize? Keep your notes, refer to those notes, hold people to task as to what they said they would do, and recognize when the capabilities are diminished and a person can no longer do that, that will require you to adjust your plan. Summarize your next steps and keep people posted is a recommended process as well. Next slide, please, Denise. Your plan shouldn't be too long, too lengthy, too fancy, and certainly not too formal. Use it to where you can identify tasks, identify deadlines for targeted goals, adjust accordingly when you find it's no longer feasible for a plan to be in place, change that. Allow to discuss what areas of coverage might be necessary and who will take on those roles. And by all means, use the AARP Prepare to Care guide that's included in the resources of this presentation. You'll find that it is chock full of tools, assessment tools, guides for you, resources that are available. Use that to formulate your plan. Next slide, please. Changes are inevitable. So we have to be pliable to those changes. and recognize that having conversations is the most important part of planning. Be pliable to change, make adjustments where necessary, and keep people apprised as to where you are in the process of caregiving and delivery. Next slide. Find your support. Next slide, please. Some of the resources that we find to be recognizable and easily accessible to most people are located within our own communities. We talked about social isolation. What are bus lines in your community that individuals might be able to utilize to increase opportunities for social and engagement of all natures? Consult professionals. Make sure that individuals are knowledgeable as to professionals that may be able to help. It may be therapists in the ancillary service field, speech, physical, occupational, respiratory therapy, helping people ambulate, helping them feel empowered to do things for themselves goes a long way in how an individual will receive care and services. Hire those professionals when it's deemed necessary. Next slide, please. Our final step deals with caring for oneself. Balanced caregiving with work and other family obligations is very important to recognize. So I'm going to talk a little bit now about how one can do so. Next slide, please, Denise. This basically identifies some information that you can tap into resources, care guides, legal checklists, information about community-based options of delivery of care. The number is 877-333-5885 for caregiving resources. If you're a Spanish speaker or you know someone who's Spanish speaking and wants to access this, they can dial 888-971-2013. We do have a resource or at least a listing in our caregiving booklet that will delineate these numbers for you as well. Next slide. Caring for yourself. Oftentimes, caregiving involves distance between the caregiver and the care recipient. Utilize professional resources. There are tools and applications or apps that are available for remote monitoring. Explore all types of technology available with you, to you. Work with your employer to see how you may be able to adjust your schedule to make it more pliable to the needs of the care recipient. Again, utilize family and medical leave if necessary, and use those tools to your best advantage. Understand financial impact. What impact does it provide you on your personal finances? What happens when you have to reduce your hours? What happens when you have to pass up a promotion because you're attending to caregiving processes? Those have tremendous impacts on our financial capacity. Recognize your emotions. Not everyone is in the caregiving role by choice. Some are there by design. Others are forced because there's no other resource available and they have to pick up the ball. Take care of yourself. Allow for breaks without guilt. Exercise. Make sure you're participating in good sleep patterns. Eat healthy meals. Make sure you're taking care of yourself. Look for ways by which you can reduce your stress levels, engage in fun-based activities. And the final on this sheet is caregiving services and support. Again, look to our caregiving guide to see what some of those supports are. Work with organizations such as the Alzheimer's Association, AARP, other community-based and state organization, aging and long-term services, human services, Department of Health. Those are all tangible resources that you can tap into. The final area I want to talk about here is an act. This is legislation that took place in 2015. We worked at AARP with Representative Tomas Salazar and Deborah Armstrong to put forward and see passage of House Bill 139. This allows for people who visit healthcare facilities, specifically acute facilities such as hospitals, to identify caregivers as the important care process, to allow for them to have their name listed in the medical record. This allows for sharing of information. This helps with difficulties of HIPAA, the Health Care Act, that says that only certain individuals are privy to that information. The HB 139 allows for that designation of family caregiver members in the medical record, meaning that they're privy to the treatment plan. It also requires the healthcare professionals in the hospital to inform caregivers upon discharge or planned transfer to other healthcare facilities. It requires that acute hospital to provide the caregiver an explanation of all treatment rendered. And finally, there must be instructions provided and demonstrations provided to family caregivers who identified in that medical record upon discharge or transfer of that patient from the acute environment. These are important steps that give a say, a voice to the caregiver, and it allows for them to incorporate their services into the treatment that they're receiving in a hospital type environment. Next slide, please. My parting saying is this: but no matter how they may make you feel, you should always watch elders carefully. They were you and you will be them. You carry the seeds of your old age in you at this very moment, and they hear the echoes of their childhood each time they see you. This was written by Ken Newburn in a document called Letter to My Son. Look at this as a cycle of activities that we're engaged in, and be mindful of where people are and what we can do to make for them better quality of life. Next slide, please. This is my information. My work phone number is 505-946-3601. You can call toll free 1-866-389-5636 and ask your questions of AARP staff members. My email address will be provided in the resources. Call up on me. Let us know at AARP what we can do to make your life better as a caregiver. We're really looking forward to an opportunity to interact with you. Next slide. Finally, I'd like to say thank you for being the caregivers that you are. Remember that it is a difficult task, but there are resources to help you on your journey. I appreciate the opportunity to talk with you today. I avail myself to you for future. And I want to thank Denise Paras, who was my technical support today. And without her support, this would not be possible. Thank you, Denise. I'll open it up to any questions that may be in the queue.
Just some thanks, and thank you for the thoughtful, kind, and supportive words. Thank you so much for the session. We did have one comment that Debbie mentioned. She was denied help for her mother because her dad served in between the Korean and Vietnamese War, but he served. So I don't know if maybe that would definitely want to go ahead and we could share information about your town hall coming up, Mr. Williams.
Absolutely. The town hall, if you go to aarp.org/NM, there you will find information about the upcoming teletown hall, which will allow for you to register, get information to participate. I would also strongly advise that they reach out to the New Mexico Department of Veteran Services. They have VSOs, which are veteran service officers in every community of the state of New Mexico. And those individuals are uniquely equipped to answer these questions, to identify what the eligibility to tap into veteran resources are. They are very willing to help. And I find that they are very, very helpful to me in my quest.
Okay, we're having some requests to actually look at your last slide, which I will pull up to go ahead and display your numbers again. So again, Mr. Williams' numbers, office 505-946-3601. Also the toll-free AARP number 1-866-389-5636. Again, you're getting some thank yous for this presentation.
One thing I'd like to include also a really quick means, because we are trying to be tech savvy. The best way to reach me right off the bat is through email. My email address is gdwilliams@aarp.org, and that can be found on the resource page as well. Is that correct, Denise?
Yes, it is in the chat. And also you guys are welcome to visit the AARP exhibit booth with tons of additional resources by going to exhibitors and then the virtual hall. And you should see a map of all of our virtual exhibit booths, and AARP is there. So please visit them for any additional resources that you might need. The name of the VA organization that Mr. Williams mentioned, it's the New Mexico Department of Veterans Affairs. Is that correct?
That is correct. That's the state entity, and we have a very close relationship. As a matter of fact, one of the guests for the teletown hall will be Andrew Welsh, who is the medical director or the director of the New Mexico Veterans Health System. So Andrew will be there in our town hall and answering questions. Reach out to them, reach out to the Veterans Integration Center. There are a plethora of resources that are available. Let me be a conduit by which individuals access those resources. If they have questions, call upon me and I'll provide the best guidance possible to connect with those resources.
All right, great. Thank you, Gary, for your presentation. Everybody is super thankful for your time today. And again, if anybody has any questions, visit the exhibit booth or feel free to reach out to Mr. Williams directly.
Thank you, Denise. You've been wonderful, and it's been a pleasure to work with you. Thank you, everyone, for taking on the role as caregivers. Your services are invaluable.
Thank you. Bye-bye.
Goodbye.